Welcome back. I'm Nurse Educator Chelsea, and today we're going to be talking about hypertension. Hypertension, also known as high blood pressure, is when the force of blood pushing against the walls of blood vessels is consistently high. This causes the heart to work harder to pump blood. In general, high blood pressure or hypertension is considered to be any blood pressure reading above 130/80. Hypertension can also affect children, but today I'm only going to be talking about hypertension in regards to adults. You can see on your screen now a chart of blood pressures in different categories and the correlating blood pressures. Hypertensive crisis, you'll see at the bottom, and that is a medical emergency. Often people can have high blood pressure for many years without any symptoms. This is why hypertension is often called the silent killer. For some, symptoms of hypertension can include shortness of breath, chest pain, headache, or nosebleeds. Hypertension can be classified as primary hypertension or secondary hypertension. Primary, also known as essential hypertension, is when there is no identifiable cause for the elevated blood pressure. It tends to gradually develop over many years, and plaque buildup in arteries, also known as atherosclerosis, can also increase risk of elevated blood pressure. Secondary hypertension is caused by an underlying condition and tends to appear suddenly and cause higher blood pressures than primary hypertension. Some medications or conditions that can lead to secondary hypertension are kidney disease, cocaine or amphetamines, congenital heart defects, adrenal gland tumors, obstructive sleep apnea, thyroid problems, cough or cold medicines, some over-the-counter pain medications, or birth control. Some risk factors for hypertension includes family history, smoking or vaping, being overweight or obese, having a sedentary lifestyle, excessive salt intake, stress, pregnancy, low potassium levels, excessive alcohol consumption. Risk of high blood pressure increases with age. Some ethnicities, such as Black individuals, tend to have a higher risk of elevated blood pressure, and those with chronic conditions, such as kidney disease, diabetes, and sleep apnea, tend to have a higher risk of developing hypertension. Complications from hypertension can include heart attack or stroke, heart failure, kidney problems, aneurysm, eye problems, metabolic syndrome, changes in memory or understanding, or vascular dementia. In addition to monitoring blood pressure, your physician may order other testing, which can include doing an EKG, an echocardiogram, or blood work to check cholesterol levels, blood sugar, liver function, kidney function, and thyroid. Treatment for hypertension includes smoking cessation, eating a low-salt, heart-healthy diet, limiting alcohol intake, getting regular physical activities, maintaining a healthy weight or losing weight, managing stress, and getting enough sleep. If lifestyle modification isn't enough to control hypertension, medications may be prescribed. The most commonly prescribed medications are diuretics, ACE inhibitors, ARBs, or calcium channel blockers. These aren't the only medications, but they are the most common. Nursing implications when caring for a patient with hypertension can include teaching them how to check their blood pressure at home. Digital blood pressure cuffs can be purchased for around $20, either online or at most stores that have a pharmacy. It's also important to provide education on a low-salt diet and educate on checking the sodium levels in processed foods or foods that are pre-prepared. Encourage an exercise routine Even just walking 15 minutes a day is a good start for most people. For those with high stress, it can also be beneficial to provide them with stress management strategies. If your patient is currently a smoker, it's important to give them information and resources about smoking cessation. And lastly, just reinforce that they take their medications as prescribed and follow up with their physician as recommended. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.